as few as 20% failed this particular test. But in this case, nearly 100% of all the students failed the test. So actually what we see are striking equalities across two cases. If we make the pass-fail rate a constant, like in the Vleuten application, we find tremendous variation in the passing scores. If we keep the pass-fail constant, we find tremendous differences in the pass-fail rates. Now let me phrase a question. Where would you send your son or daughter? Would you send him or her to Maastricht or to Groningen? Because if you look at the pass-fail rate, the average pass-fail rate in that time, we're talking about true historical data in the 80s and the 90s, in that time, an approximate 15%, a constant percentage, failed the test, the block tests in Maastricht. Yet in Groningen, approximately 50% of the students failed their first test take on their exams. A huge difference. The other question I could ask is, you probably would send your son or daughter to Maastricht because it's more easy to become a medical doctor there. But then the next question would be, where would you select your residents from in your residency training program, from Maastricht or Groningen? Probably you would say, I would select them from Groningen, because there they are more harsh and I would get better doctors. Or in other words, by setting different standards and levels of standards, we produce different quality of graduates. Let's explore the hypothesis. We have lots of data where we compare our graduates here in Maastricht to other graduates from other medical schools. Here I took a sample of a progress test, as we have it, which is a written exam which is administered to the full student population within the medical school at the three sites, in this case Maastricht, Nijmegen and Groningen. Here we see the averages for each of the medical schools across each of the years of training. We have a 6-year undergraduate medical program, and the bar is the 95% confidence interval. Basically what we see is no difference. Or in other words, there is no direct relationship between the average pass-fail rate, let's say the validity of the pass-fail decision, and graduate quality. So what's going on? Let's explore this comparison a little further. Let's look at the progress test score of our graduating students at the end of the 6th year, and let's compare our graduates and their scores on the different disciplines with the scores of graduates from another medical school. And this is exactly what is being displayed in this slide. As you see, there's a lot of variation, but the variation is pretty much the same across both schools. Now we have progress tests. We have multiple progress tests during a year. Suppose this is the result of the December 1995 test. We do this 4 times a year. Let's look at the next progress test, which is the March 1995 test. Now we see we again see the same spikes across the disciplines, but the pattern across both graduates is virtually the same. Now what we could actually do is to calculate a correlation coefficient for this profile across the two schools. And given the fact that they so closely resemble each other, this correlation is probably very high. What we could also do is to correlate the scores on surgery from the December test with the March test and the embryology scores. and the biochemistry scores across the two test occasions, here's what we get. This is the correlation across the profiles, which is very, very high. And here's the very low correlation, or rather low correlation, of the scores across the same disciplines across different test formats. Here's an explanation for all the variation that I have shown previously across the two cases in Groningen and Maastricht. Let me make it more clear. When a discipline has more difficult questions in one particular test administration, a next test administration with new test items may have a totally different difficulty. There's hardly any correlation between the difficulty level of a certain set of questions for a given discipline across multiple moments of measurement. Yet in other words, item difficulty is a tremendous factor that influences test scores. And this has been found in a lot of different situations. It's very hard to predict the actual test difficulty before the test is being administered. But every new set of questions will produce a totally different test difficulty. Why am I alluding so much on this particular problem? I wanted you to see the impact of item difficulty and therefore test difficulty on the score range on a particular test. And it tells us that any sort of standard setting method that doesn't reconcile in some way the item or test difficulty is not that credible as a standard setting method that does reconcile item or test difficulty. Okay, with that in mind, we can now go to the next part and discuss the various methods of standard setting. Probably the most common one is the very arbitrary cutoff. Let's say 60%. Below that point you fail, and above that point you succeed. Interestingly, there are very different conventions across different countries. I mean, the UK has a different percentage than the Netherlands. But the question is really, why is it 60%? And why is it not 61% or 65 or 50 or whatever? The arbitrary cutoff, which is the most common method of standard setting in education, does not reconcile any variation in test difficulty. And we now know that that variation is tremendous and has a huge impact on the scores. So basically, the conclusion would be that the most common method of standard setting is the least credible one. Okay, then what to do? Suppose you have to set your standard, you have to wish to set your standards in a more absolute fashion. Well, a number of methods have been developed that use panels of judges to judge test items. 3 of them are listed here. Probably the most popular one is the Angoff. And I will illustrate the Angoff by presenting